Yo, 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 what is going on, people? It is your boy Chuck back at it with some more content for you guys. So, today is actually episode one of Fix Myself. So, Fix Myself is a little mini series that I'm going to be starting that's focused primarily on issues that I'm kind of dealing with that are hindering my fitness progress. So, at the moment, I'm dealing with some right hip and knee pain and tightness, as well as some ankle tightness. So, this has been kind of hindering me throughout my leg days over the past couple months. So, just going to be talking about what I'm kind of doing to address that. I will be uploading a fix myself for other body parts. That'll be a whole nother video. Today is focused on the legs. So, as you can see, these first two clips, I'm actually doing some banded joint mobilization. So, this is for hip internal rotation. I lack hip internal rotation, right? So what I'm doing is I'm forcing internal rotation while having a band as high up on my leg as possible to kind of pull my hip back into the right place while I'm encouraging the internal rotation. So over time, what's going to happen is my internal rotation is going to become a lot better without the band. I'm going to have less pain, less tightness, and when it comes to leg days, specifically squats, I'm going to be in great shape. So next is ankle mobilization. I definitely lack ankle mobility. I can get pretty deep on my squat, but I can't. I really want to be able to get a lot deeper, and I feel like I definitely can. I notice I have a lot of tightness in my calf anyway. So, what I'm doing with this is putting the band right on my ankle bone, and I'm putting a little bit of weight on the top of my knee and encouraging the expansion of that joint, not the expansion, the mobility of that joint. And the band is encouraging the ankle to go back to its normal position. So what's going to happen is naturally without the band over time, my knee is going to be able to go farther in front of my toe, and that's going to be a lot better in terms of my ankle mobility. Going to be able to squat a lot deeper, and it's going to help with just overall stability within my legs. So next, just a little bit of soft tissue work. So I'm doing some self-myofascial release, specifically using a foam roller. If you've been lifting for a little bit or you're an athlete of any sort, foam rollers are definitely familiar to you, but try this method. Instead of just rolling back and forth on the foam roller really fast, find the most tender spot. And for my calf, I put just specifically for the calves, I put one leg over the other to add some more pressure, and then I started twisting my ankles around. And it was so tender. I was really able to get in there and reduce some of the sensitivity that I had to some of that tightness. So that way, I'm not going to be naturally compensating throughout my workouts. Next is another hip opener. These are called kettlebell weight shifts. I learned these from Squat University. I learned a lot of stuff in terms of mobility from Squat University, but this is just a hip opener, good for hip external rotation and using the weight to just support the push of opening it. And then the very last thing that I did was these clamshells. So these kind of work your core a little bit because you're doing a bit of a side plank, but just using the resistance of the band, just opening up those hips. I will say that this band that I happen to have is not as strong in terms of resistance. However, it still gets the job done, and it's actually an insane warm up for my glutes. So by the time that I finish this entire mobility routine, I can jump right into my first exercise, which is usually going to be some sort of squat movement. Um, all of my muscles have been activated, besides my hamstrings, which normally I'll just activate those with easy warm up sets before I target them. But yeah, so far this has been helping me a ton. I feel a lot better. I still have a little bit of pain, a little bit of tightness, but it's a work in progress. So I'm going to do another episode with a different body part, but each week I'm going to show the progress of my mobility as well. If you guys have any questions or concerns, feel free to comment down below or hit me up on socials. Take care.